Today, we want to talk about cluster headache. It's another type of primary headache, different from migraine. And let me just remind us again that primary headaches are the headaches where the headache is the illness, as against secondary headache that is a symptom of another disease. So cluster headache is another primary headache. It's normally commoner in males. It's not very common actually. Migraine is a lot more common. But cluster headaches are commoner in males, and it's a very intense pain. Very painful. In fact, I remember one man when we were medical students that came with it, and he was in so much pain. So the pain of cluster headache has been adjudged to be one of the most painful things. It's more painful than childbirth, more painful than the pain of kidney stones, and of course, more painful than migraine. Normally lasts between 15 minutes to 1 hour 30 minutes. It's usually on one side of the head, and at the same side of the head with the pain, the patient will have what we call autonomic symptoms, usually producing tears on one side, or having discharge from the nose on one side, or may notice some that is sweating only on that side of the face, okay, or nasal congestion. That's maybe you're not really discharging from the nose, but you feel that the nose is stuffy on that side. Well, it can also have migrainous symptoms like not wanting to see light, not wanting to hear sounds, but they are not very typical. Okay, so there are a few things about cluster headache. One is that it starts suddenly. And within a few minutes it has reached the maximal intensity. So that's one thing that that is quite classical about cluster headache. And then there are triggers. Triggers are usually known. Common triggers include alcohol, exercise, strong smells, cigarettes, and anything. Usually those that suffer cluster headaches know their triggers. Then some other thing that gives it away is that it has what looks like a clock-like regularity. So the person knows that this headache starts at 2 a.m. So you can anticipate when the headache will start. So is that regular, the cluster headache? And when it starts, it's so severe and is associated with restlessness. So unlike migraine that will make the person want to lie down, cluster headache makes the person restless. The person is moving about. In fact, the patient I talked about said that what he feels like doing is hitting his head on the wall. So it's that painful, and after 1 hour 30 minutes the pain relaxes. So yes, cluster headache is a primary headache, but when a patient presents with symptoms that look like cluster headache, it is always very good to get neuroimaging, because when there are tumors around the pituitary gland is a gland in the brain, those tumors can present themselves as headaches that mimic cluster headache. Is it treatable? Yes. We have the chronic type, we have the episodic type. It just means that the episodic type, sometimes the patient gets a pain-free interval of 3 months or more. And strangely, those triggers cannot trigger the headache within that pain-free period. And then after the pain-free period, the headache comes. In fact, the name cluster comes from the fact that the headaches occur in clusters. And after a while, the patient enjoys pain-free period. Then after the next season comes on, the next set of cluster headaches come. And throughout that period, the patients will be having regular headaches until that cluster goes away. So if you are dealing with this type of thing, most times it looks like a headache that was sent, because the way it starts, the severity, people feel, this headache must have been sent by my enemies. So if you're living with something like this, or you know somebody that is living with something like this, you may do well to educate the person that it may not be village people that they're thinking about, that it may be cluster headache, and encourage the person to go to the hospital and seek help. Preferably a hospital that has a neurologist that will be able to identify what the person is dealing with and offer some help. Thank you.